Hello ladies and gentlemen, Dr. Paul Teich here. My website, www.drpaulteich.com. Please visit it. Today, I'm here to talk to you about carpal tunnel syndrome. Carpal tunnel is the number 2 workers' comp related disorder on your planet Earth today. I won't go through a list of all the things that could possibly cause carpal tunnel. However, everything that we do that grasps causes occupational carpal tunnel. That's why it's the number 2 workers' comp related disorder on planet Earth. When we extend our hands, we are performing something that we never perform, hardly ever, in daily life at all. Were we to type, we press down with 8 times the force that we pick up. Were we to play an instrument, and there are even many sports-specific and music instrument-specific doctors that will help people with different types of instruments and extending their playing career. What we're talking about today is everything that we do, from brushing our teeth, counting money, I hope for you, typing, driving, eating, cutting your meat, whatever it is, always uses the flexion part of the arm and hand. It uses this muscle right here. And as you can see, that muscle on this side, flexion, is much bigger than on the other side, which is the extension portion. What this does is it creates what they call an irregular tensile tense load, which is a physics term, meaning 5 rubber bands here, 1 rubber band here. Everything that we do is grasping. Nothing that we do is extending. Therefore, we develop this side 5, 10, 15 times more than this side, and it causes an occupational carpal tunnel. So the first part of my program are a few stretches that I learned from the great Aikido master Maruyama, which brings about how we learn from Chinese medicine that martial arts uses the same things to hurt as it does to heal, but possibly in a different way. All of the throws from Kung Fu, which you shouldn't do, it's something that I perform on you. But just as an example, I might take your hand in this position, that position, this position, that position. 1, 2, 3, 4, 5, to stretch and bring flow of nerve, blood, and lymph greater through the entire arm. What I want to show you today is this orthopedic device. I call this a rubber band. I recommend the purple rubber band that you might get from asparagus or from around a stalk of Brussels sprout. You take this rubber band and you put it around the first knuckle of your fingers. Let me get pretty close there so you can see that. And I'm opening it right there like that. And what I'm going to do is grasp my hand to isolate the motion. And just like I was going to exercise the spine, we did a spinal mobility class in Dr. Paul Teich Exercises for Life, another segment, we're going to bend forward. And I have my hand opened, or else the rubber band would fall off. I'm going to bend backward. I'm going to bend to one side. I'm going to bend to the other side. I'm going to circle in one direction. I'm going to circle in the other direction. I have just performed awesome carpal tunnel rehabilitation. What we need to do is take one of these orthopedic devices before we play the piano, after we play the piano, before I play my ukulele, after I play my ukulele, before I work on a patient, after I work on a patient, before a massage, after a massage, and do a set of 10. Forward, backward, left, right, circle in one direction, circle in the other direction. I can tell you years ago I flew off a motorcycle and landed and bounced on my wrists. If I didn't do this every day, I would have terrible arthritis and have lost range of motion for sure in my hands and wrists. You might do a set of 10. Forwards, backwards, left, right, circle in one direction, circle in the other. Next. Forward, backward, left, right, circle in one direction, circle in the other direction. Next. We might do a set of 10 where we're doing 10 on the left hand, 10 on the right hand. And if you can imagine all of the times you have used the grasping portion of your hand and not used the extensive portion, that shows us how behind we are in the rehabilitation of preventing carpal tunnel, the number 2 workers' comp related disorder. It can be prevented with this rubber band. There's 12 basic things that cause carpal tunnel. I won't list them all, but they range from an anterior lunate, which is one of the carpal bones in the wrist, which puts pressure on the median nerve, causing a carpal tunnel. So people may come to a chiropractor and say, I have carpal tunnel. The chiropractor gives them an adjustment, and it goes away. Oh my God, how did that happen? Well, it could come from entrapment in the wrist, the elbow, the shoulder, or the neck. Any of those a chiropractor could handle. However, if they did not employ therapeutic exercise as we have described it here, unless it was due to a pure entrapment and not due to something that is already going on in everyone and you, it wouldn't be 100% cure, and that is why I teach people the rubber band. That's carpal tunnel rehab with the rubber band. I wear it on my wrist. I take it with me everywhere I go. And if you won't do this exercise and you start doing it in the mirror so that you can look and make sure it's done perfectly, there's no sense in getting something better than the rubber band. I do have a $25 unit, 3 different carpal tunnel units that you put your hand in and open are a little better than the rubber band. But in my opinion, you need at least 2 of them, one of the better one and the rubber band. So if you're not going to do the rubber band, don't even bother calling me for one of the better ones. So thanks, and God bless.